Okay guys, let's go over stapling. Super great places to use staples are scalps. That's my #1 place that I use staples, especially little kids that fall and only have like a 1 centimeter incision on the back of their scalp. 2 quick staples and they're done and out of there. Most little kids with just tiny lacerations on their scalp, I don't even use the lidocaine. They freak out when they see the needle and they think they're gonna get a shot. It's just easier to papoose them, keep them calm, 2 quick staples, and get out of the room because now they hate you. Okay, all staples. You can see on the end here, there's an arrow. Where's the other staple? Where you line up your stapler over your laceration. This arrow is really just very simply, this is your center point right here, and this is what you would line up over your incision. So when you're gonna staple a laceration, you're gonna clean it, anesthetize it, just like you would just a regular cut. There are all different kinds of staples. They all come in different packages. They all look different, but they are all basically used the exact same way, okay? This is, again, a sterile procedure, and you can see that this instrument has a really great center arrow where this one does not. So when I approximate my lacerations, I just use my fingers very simply to bring that skin close together. So you would use your fingers, try to get a little pucker because that'll mean you've got a nice good seal there. Line your arrow up right over the center of the laceration and squeeze. Now, your patient is gonna hear that little noise, so you might tell them, hey, you're gonna hear that funny little noise. All patients really do complain about that. And then just line your staples up about 1/2 centimeter apart, okay? So there you go, staples. The great thing about this is after 24 hours, grandma or grandpa can go ahead and take a shower. Mom can put that little boy, stinky little boy, in the shower, wash that really good. 24 hours, keep the wound dry and clean, and then you give the patient the exact same instructions you would for a laceration. Clean it twice a day with soap and water. Those staples need to come out in 7 to 10 days at the doctor's office, and just remind them that it takes a special instrument to get those staples out. That they can't do that at home on their own. Again, my sweet little meth heads in the ER will try to attempt this by themselves at home. So really do remind your patient, give it to them in writing so that you are legally covered. Staples out in 7 to 10 days. All right.